Hello, my precious ones. Today we're going to discuss men's health, prostate cancer to be precise. Prostate cancer is one of the most common cancers in men and also one of the leading causes of death in men, especially Black men, because Black men are more at risk. It happens all the time, yet many don't understand the risks, the symptoms, and the value of early detection. In this video, I am going to tell you the risk, the symptoms, who gets it, and how to protect yourself, and what treatments are available. Whether you're a man or you have a man in your life, which most people will have a man, otherwise they won't be here, because if nothing else, you have a father. This video is for you. Let's dive in. So, what are the risk factors? Number one, age. Men over 50 years old tend to get it. Number two, ethnicity. Black men tend to get it even more. Number three, family history and genetics. If your daddy had it, your senior brother, more than likely you may also have it. So if there's a family history of prostate cancer, it's even more imperative that you begin protecting yourself as early as possible. And finally, lifestyle has a role to play in everything. What are you eating? Are you exercising? Are you obese? What is your weight? So that also has a part to play. What are the symptoms? Be mindful that in early stages, there are no symptoms. A lot of things are silent killers. But when the symptoms begin, can be number one, painful urination, painful ejaculation, blood in the urine, and finally pain in the hip and back. So if you're experiencing any of these constantly, please see your doctor. How is this detected? The very first thing is a PSA test. It's a blood test that is done by your doctor and in the lab to see what the values are. Secondly, your doctor can actually do a rectal exam and feel for abnormalities in the prostate. Thirdly, there has to be a biopsy if it's suspected. Then lastly, there's imaging, CT scan, MRI, and things of like nature. When cancer is confirmed, what are the treatment options? Number one, it may just need to be monitored. If it's not growing, close monitoring to see what it's doing, maybe with PSA tests and biopsies. If it doesn't grow, there might not be need for any treatment. But if it's growing, then you have the options of surgery, options of therapy, immunotherapy, chemotherapy, cryotherapy, and a few other ones. And these are the treatment options that your doctor will have to discuss with you to see which is best for your situation. We have discussed the risk, the symptoms, and the treatment available. Now, I want to say that the things you can't control are the lifestyle aspect of it. You can make sure you're eating healthy, make sure you're exercising, and make sure you are at the weight that is recommended for your height. These are things you can do to protect yourself. If it happens to come, it's a challenging diagnosis, I'm sure, but it's not the end of the world. With early detection, many people will not even know it ever happened. With advanced treatment and the support system, many men that are diagnosed will still live a full, healthy life. So, again, I would suggest pray. Prayer is involved in everything. So, don't think it's the end of the world. There is life after prostate cancer. Thank you for listening. Please make sure you get yourself checked regularly. My brothers, my fathers, my husbands, my sons, my uncles, please get yours tested. The test is called PSA. More importantly, speak to your healthcare provider to give you more information one-on-one. Thank you for listening once again. Until next time, God bless.